I saw this amazing debate between Ben Shapiro and Anna Kasparian the other day, where she nailed it with you guys were talking about healthcare, and he brought up some point about, well, people are too fat here. That's the problem.
Yeah, I was gonna bring that up. I know, yes. Where
there
he's
you go.
just like, yeah.
Well, we actually have this clip.
What's the number one policy you'd like to see the Democratic Party pursue? You're a legislator now. You've been elected president. What's your first initiative as president of the United States?
You couldn't do this unilaterally, but I think one of the main policies that would improve a lot of these other issues that we're talking about is healthcare. Single-payer healthcare. Or at least, in the very least, in the short term, just reform healthcare to a point where everyone has the coverage they need to get the care they need. So the untreated mental illnesses that we're seeing on our streets right now, that is a byproduct of a broken healthcare system. I want to fix that. That would be, again, the number one thing I would focus on if I had the power to really make that change.
So, obviously, I think that we all see the problems with the healthcare system. It's sort of a weird Frankensteinian monster, this sort of private public monster in which virtually all medical care in the United States is publicly subsidized at some level by Medicare, Medicaid, by hospital reimbursements that are involved with local and state regulation. Though the levels of regulatory thickets and the amount of administration, the administrative cost for healthcare in the United States is extraordinary.
Yeah.
It's extraordinary. And, I think that the big problem with healthcare is that everyone, it's such a thicket now that no matter which side you come at it from, you are going to get wrecked for even poking a stick into it, right? The minute you poke a stick at it, ooze comes out. Because if you come at it from my side of the aisle, which is it needs more privatization, we should get rid of the connection between your employment. If I were coming at this tabula rasa, you get rid of the connection between your employment and your healthcare. It's absurd. Why is your employer paying for your healthcare in the first place, right? You should.
Well, how would people? So look, I agree with you on that. I think a single payer system would do away with the need for employers to provide coverage for their employees. I actually hate the system where if you're working at a place that you might despise and you want to move on, or maybe you want to start your own business, right? You're less willing to do it if your health care is reliant on you staying at the company you hate so much.
Right.
I think it's actually stifled a lot of economic growth. I think there would be a lot more small businesses, successful small businesses, if people had that freedom to just walk away knowing that they wouldn't lose their health coverage as a result. You get what I'm saying?
No, first of all, I totally agree with you. I think that's why I would prefer to go back to individual and community-based insurance. Right? This is why the lack of social fabric really is a problem, because in my vision of a perfect healthcare world, essentially because you know your neighbors and you know your community, and you don't want your neighbors to die, your community helps subsidize your healthcare. But I have very serious doubts about the national community subsidizing healthcare at a large scale, because I don't know that person in New York. I don't know what their habits are. I don't know what incentives they have to engage in the healthcare structure. And you do see a wide variety of sort of models that have been used, right? Singapore is a much more privatized healthcare system than, for example, Great Britain. So there are a bunch of different ways to sort of slice this particular issue.
Yeah. You know, what's interesting, because we hear a lot of, I feel like the right wing in America puts words in the mouths of Canadians and people living in Great Britain when it comes to their health insurance, policy, and their nationalized health care. But you talk to them and they seem to love it. So I'll give you an example. So when Boris Johnson was running again for prime minister, what was really interesting is how he kept emphasizing the need to bolster.
Oh, it's a third rail there. You can't touch it.
But it's a third rail because of how much the people living there love their healthcare system. And so there's freedom that comes along with that. When you consider the fact that our life expectancy in the United States is comparable to that of Cuba's, there's something broken in our system.
Well, so first of all, whenever we get into these sorts of discussions, you have to start looking at apples to apples comparisons in terms of the demographics of the United States, our age, the ethnic composition of the United States, because different ethnicities actually have different health problems disproportionately. You have to look at the poverty rate in different areas. Obviously, the life expectancy in Vermont is significantly higher than the life expectancy in, say, Alabama, and so that is a wide gap that is not really attributable necessarily to healthcare quality, because again, the same national system applies to both Vermont, and Alabama. So you have to, the United States is also a country of 340 million people. Cuba is a country of significantly fewer people.
Right.
So, I mean, all of these, this is why I sort of object to any attempt to use Norwegian models and apply them to a significantly more diverse, heterogeneous, and large country.
Well, okay, so let me get into that, because if you look at what's worked, because Cuba, I mean, obviously incredibly poor country, especially with embargoes and all of that. Donald Trump declared it a state sponsor of terror, which led to other countries feeling very uncomfortable doing any business with Cuba. So its healthcare system is severely under-resourced. But what they've done correctly is they've focused most of their energy on preventative care, because preventative care is less costly than just allowing people to get super sick. At that point, you know, whatever illness they have is a lot more costly to deal with. So they're like, all right, we don't have the resources. We just got to make sure we really hone in on preventative care. That's worked out really well for them. Whereas in the United States, people aren't getting the preventative care they need to prevent severe illnesses because it's so costly, right? So we need to do something.
Well, I mean, first we should tell people to stop eating so much.
Yeah, that's a good approach. Hey, stop eating. I've never heard that one, you know? You know, every time I eat, you know, cupcakes, I'm like, oh, this is encouraged. This is an encouraged thing.
Does he really, like, I remember conservatives freaking out about Michelle Obama, like, sort of encouraging kids to eat more vegetables, that this was like horrible government overreach. I don't know if you guys
I know. It's great.
So it's like I want to know what the Ben Shapiro plan for getting the government to tell everybody to stop eating so much looks like.
Also, you know, look, to be fair, he didn't really elaborate on how this would be beneficial, because he would like to see more privatization in the healthcare industry. And he thinks that it would somehow improve our current predicament with how broken our healthcare system is. But okay, I'm going to give you an example of something. Okay, specific, it's anecdotal, but I'm sure many people have similar experiences. So I found out last year that I have psoriasis, which is a real bitch. Okay. And so I go to the doctor prescribes me a steroid cream that anytime I have some sort of flare up, like put the steroid cream on, except I don't want to use steroid cream for the rest of my life. Find out that there's like this new medication. It's an injection you get like every 3 months or something. And it clears everything. You don't have to use a steroid cream, which has all sorts of side effects that I'm uncomfortable with. But guess what? Private insurance will not pay for it. Private insurance forces you to go to a dermatologist and try a billion different like potential solutions, like a gluten-free diet or whatever, UV treatments, nonsense. Every nonsensical treatment you could think of, you have to exhaust all of that before insurance is like, oh, fine, we'll cover it. Okay. Another example, I was talking to a friend who has ADD. And he was telling me that right now there's like a nationwide shortage of Adderall, which I can't believe it's still going on. But he told me that it's a nationwide shortage specifically of generic Adderall. The brand name is available and it's plentiful. However, insurance won't cover it. So there are all these people in the country right now who are really, really struggling with untreated ADD because the insurance will not pay for the brand name version of that drug. So wait, hold on. How is privatizing the system further going to make it better? Because privatization means you introduce a profit motive in the system. Insurance companies are not looking to keep you healthy. They're looking to make money off of you. And so they're going to look for any excuse to avoid providing coverage for all sorts of treatments and medications that you need.
So
anyway. Yeah.
And I really want to know, like, these extra privatizations that he wants, what are we talking about here? Because, like, other than Medicare for seniors and you know, Medicaid for very low income people and people on disabilities, like, insurance is all private already. So it's like, so either we're talking about privatizing one of those things, which, man, I'd say it a little louder that's what you want to do, right? Or what we're talking about, like selling, you know, like more hospitals that are owned by the county to like a bank, like it's that definitely sounds like it's going to give everybody better health care. But like, I love that in his response, right? I mean, like, you sort of started out, you have this like very straightforward, like, yeah, we should have Medicare for all. Here's all the good things that would do. that would that would mean that people weren't afraid to, didn't stay in jobs that they hated because they couldn't give up their employer health insurance. I mean, you could add there are people who stay in bad or even abusive marriages because they don't want to give up their spousal health insurance. So and hey, look, Canadians seem to like it. British people seem to like it. Boris Johnson had to pretend, that he liked it. It seems to have all this stuff going for it. And his response was one, okay, you have to have it's like, oh, he agrees that employment should be linked to health insurance, but it's like, I think you started to ask this and then he kind of gish-galloped off to some other stuff. Like what? So what's the plan? Like, does Ben Shapiro want to ban offering health insurance as like part of a package of benefits?
I don't know. I don't know.
He went further. It was funny because he's like, yeah, I agree with that. I agree that there shouldn't even be employer. We should have worse than that. You know what I mean? Like it's crazy.
Well, it should only be your community because I don't know people.
I like that. I had to ask my neighbor for the code to the laundry room the other day, and I should have been like, hey, can you pay for my health care too? When I was there, that would have been awesome.
By the way, I feel the same way about my neighbors literally living in the same building as me as I do people living in Florida. Okay.
Yeah.
You're fellow Americans, you're people, and we live in the richest country in the world, and you shouldn't have to struggle for your health care. Also, please don't talk to me. Just
yeah.
You know what I mean? Like, I don't have to love you, and I don't have to see you as part of like my family.
Yeah.
To want you to be good, to want you to be healthy and safe, and
I also don't know look, I don't know. Especially, right now is a bad example given where I live currently, but they have when I was, last year when I lived in Atlanta, I have, it's like, look, I don't know most of my neighbors. I certainly don't know their kids, but, I'm still happy to pay taxes that pay for those kids to go to school. Cause I don't think it's like, I don't know those kids. Maybe they suck, I have I still think they deserve, an education, and, and I still, and it shouldn't matter whether I think that or not, I should still have to pay that. So that was weird. But the other thing, and by the way, all this stuff about social fabric, it's like, well, you can't have it both ways, man. They have the reason why the social fabric is bad is because we live in a economically precarious, high crime, which is also downstream of of all the economic stuff, stressed out.
But also, let's discuss the social fabric of America for a second, right? Because listen, I'm really not interested in hearing from perpetuators of the incessant manufactured culture wars talking about the social fabric of this country, because the whole point of the manufactured culture wars is to divide and conquer, right? Absolutely. For Americans to see other fellow Americans as the others, as the enemy. And I think it's gross. And I want to fight that, right? Because the more we feed into that, us versus them narrative, the harder it is for workers, even in like a specific workplace, to see each other as, what I love about the discussions that like you and Michael would have all the time, Ben, is that you guys would focus on how those in the same class have far more in common with one another, as opposed to someone in the top 1% who might share some other identity point, whether it be their race or their gender or their sexual orientation, all of that stuff. And that's 100% true. And if Americans can just really understand that and internalize that, I think we'd be in a way better place.
You have been watching free public content from Give Them an Argument. To access every single episode of the show, the main show on Monday nights, all of the streams, all of the debate breakdowns, all of the patron-exclusive postgames on Monday nights, all of the patron-exclusive bonus episodes every week, and much, much more, go to patreon.com/ Ben Burgis. I cannot resist ending this with, don't be foolish.